Good day everyone. In today's video, we will be tackling all about appendicitis. So let's get started. So, what really is appendicitis? Appendicitis is an inflammatory condition characterized by the swelling and infection of the appendix, a small pouch-like organ located in the lower right abdomen. It occurs when the appendix becomes blocked, usually by a buildup of fecal matter, causing bacteria to multiply and leading to infection. Let's now talk you through the pathophysiology of how appendicitis develop. First, there will be an obstruction of the appendiceal lumen inside the appendix. There will then be a buildup of mucus in the appendix. This buildup of mucose caused an increased pressure in the appendiceal lumen. Due to the added pressure in the appendix, there is now a decreased blood flow to the area. Due to this insufficient blood flow in the appendix, an ulceration lesion in the mucosal lining happens. This breach, or ulceration inside the lining, allow bacteria or other pathogens to penetrate and infect the underlying tissues. All this then leads to an inflammation and swelling of the appendix, which is what we now call appendicitis. Moving on to the risk factors or factors that increases risk or susceptibility to this condition. We first have increased pressure in the intestine. This includes holding your poop for long periods of time, which puts pressure on your intestines. We then have family history. Some appendicitis are a product of genetics, passed on from a generation to another. Next, we have viral or bacterial infection in the digestive tract. An already present bacterial infection in the GI tract adds up or promote infection on new appendixes, which leads to appendicitis. Another factors to consider is sex. Researchers found out that appendicitis was more common in males than females. They also found out that it is more common among teenagers and those in their 20s. Moving on to the signs and symptoms of appendicitis. One of the many signs and symptoms you might encounter is the feeling of nausea and the tendency to vomit. Another is the loss of appetite. You might also feel pain on the right side of the lower abdomen. It could be that you will experience a low-grade fever at this time. You might even feel the need to fart or flatulence, constipation, or even diarrhea. Moving on to treatment options. Appendicitis treatment usually involves surgery to remove the inflamed appendix. But before surgery, you may be given a dose of antibiotics to treat infection. After taking antibiotics, your appendix will usually need to be removed as soon as possible. There are two ways in which surgeons approach this method. One of which is traditional or open surgery method, which involves a cut in the lower right-hand side of your belly. And there is also the laparoscopic method, which uses several small cuts or incisions and a camera to look inside the belly. For better promotion of health and the prevention of this disease, it is best that we eat food high in fiber, which includes fruits, vegetables, lentils, split peas, beans, other legumes, oatmeal, brown rice, whole wheat, and other whole grains. Regular exercise can also prevent you from having appendicitis. Good hygiene practices also help reduce the risk of infections that may contribute to appendicitis. Another way to prevent this is by emptying the bowel completely. Lastly, if the patient has appendicitis, do not apply heat to the patient's abdomen, as this could lead to rupture of their appendixes. Finally, the prognosis. With an early operation, the chance of death from appendicitis is very low. The person can usually leave the hospital in 1 to 3 days, and recovery is normally quick and complete. However, older people often take longer to recover. Without surgery or antibiotics, as might occur in a person in a remote location without access to modern medical care, more than 50% of people with appendicitis die. The prognosis is worse for people who have a ruptured appendix, an abscess, or peritonitis. That would be all for today's video. I hope you enjoyed and learned something from this discussion. Thanks for watching, and never forget to take good care of yourself.